Everyone, welcome back to Public Health Insights. In today's video, we are going to discuss a very important topic, that is dimensions of health. This topic is very important for NEET UGC NET MPH entrance examinations, and also sometimes it is asked in UPSC. So in this video, I am going to explain the topic in very simple, detailed and example based manner so that it becomes easy for everyone to understand. So let's start. So talking about the content, so this is the format that we will be following. Now, first of all, when we talk about dimensions of health, then we need to understand what does dimension mean and what does health mean. So, basically, health is something, the definition of health is something that every one of us is aware about it. And we know that health has different dimensions, and different definitions, as in, because everybody uh, perceives health as something different. But when we talk about health, then there is a standard definition that we need to have in our mind. That is the definition given by the World Health Organization. So according to the World Health Organization definition about health, that was given in 1948, health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Okay, so here you see there are some keywords like physical, mental, and social well being. What are these? So, these are the core dimensions, that is, physical, mental, and social. We'll be studying it in detail in the further slides. Then, talking about dimensions, so, dimensions of health are the different aspects or components of human well being which together determine a person's overall health status. So, these dimensions are usually interconnected, these are dynamic, that means it is not static, it keeps on changing. Okay, meaning they change over time, and also these dimensions influence each other, so they are interconnected. If one dimension is disturbed, then the other dimensions are also affected. Talking about the dimensions of health, we have two types of, or you can say, when we classify dimensions of health, we classify it as core dimensions of health and expanded dimensions of health. So, in core dimensions of health, you can see in the slide, I have highlighted the core dimensions of health. These are physical, mental, and social. And you need to keep this in mind that you have to remember it no matter what. The core dimensions are the most important dimensions of health. Okay, these are physical, mental, and social dimensions. Then we have some other dimensions that are the expanded dimensions of health. These are the spiritual dimension, vocational, intellectual, and in others we have emotional dimension, environmental dimension, and financial dimension. So let us discuss each dimension one by one in detail. Talking about the physical dimension of health, so physical health refers to the proper functioning of the body and its systems. So it includes person taking balanced nutrition, a person doing regular physical activity, having an adequate amount of sleep, somebody who is having good immunity is said to be physically fit. Then it also includes absence of diseases. So, physical dimension is everything that you see in your body. Okay, it talks about nutrition, physical activity, sleep, immunity, and absence of diseases. So, for example, a physically healthy person can perform daily activities without fatigue. Somebody who is active, who is in a habit to do regular physical activity, they can perform daily activities without fatigue. Okay, somebody who is physically healthy has normal body weight. He or she also falls sick less often. So physical health is very important, very important. And physical dimension, you need to memorize it. very well. It talks about proper functioning of body system. It includes physical fitness, stamina, nutrition, adequate sleep, good immunity, and absence of diseases. We know that physical dimension is one of the most important dimension, but we need to also remember that physical health alone does not guarantee complete health. Why? Because there are many dimensions that influence physical health. For example, think of a situation where you are emotionally not well, then you'll not be taking proper sleep, you'll not be taking proper food. So that is going to affect your health all in all. It does not matter if you are healthy physically, but if other dimensions are disturbed, then your physical dimension will also be disturbed, and that will give rise to and any kind of sickness or deviation from what we call as good health. Then you have the mental dimension of health. So, mental health refers to a person's ability to think clearly, manage stress, and maintain emotional balance. It includes coping with stress, making decisions, learning and concentration, and self confidence. So it is also very easy for you to understand it. Very, very, very easy. So I'll explain by giving an example. So a student may be physically healthy, but if they are constantly anxious, if they are constantly stressed, they are not able to concentrate, or they are emotionally unstable, their mental health is affected. And mental health is extremely important in today's fast-paced world. Why? Because we have lots of competition going on. We have lots of stress factors, in our lives. So it is very important for us to manage our mental health or mental dimension. Why? Because if that gets disturbed, all in all, the health gets disturbed. The lifestyle gets disturbed. So mental dimension is also one of the core dimensions of health, and you need to memorize it very well so that you can write in your theoretical examinations likewise. Have another very important core dimension of health, that is social dimension of health. Social health refers to the ability to form satisfying interpersonal relationships and adapt to social situations. So it includes family support, friendships, community participation, and healthy communication. So I'll give you an example. A person who is socially isolated may feel lonely, depressed, stressed, not able to express. And if all these things happen, if the person's social dimension is not well managed or social health is not managed well, then they might also feel physically unfit. Why? Because you have seen many times, you have seen that a person who is lonely, who does not have friends, they are very irritated, or they are not very not very you know active in life. So that affects their physical health, and that all in all affects the health. So it is very important for us to have a social health, a healthy social life. Why? Because we know that humans are social animals, and if we do not communicate, if we do not express ourselves, then that creates a lot of burden in your mind or in your life. It makes you feel lonely, depressed, and stressed. So that is going to all in all affect your health. So social dimension is also very important. Then talking about the other dimensions of health, we'll talk about spiritual dimension. So, spiritual health refers to a sense of purpose, meaning, and inner peace in life. And you need to remember that it does not necessarily mean religion. Spirituality is different, religion is very different. Okay, spirituality includes moral values, inner harmony, hope and purpose, acceptance of life situations. Okay, and religion is very different. So, a person who may be spiritual may not be very religious, and vice versa. Okay, so spiritual dimension is also very important. It gives you a purpose and meaning. and it also provides inner peace. So, for example, during illness or loss, spiritual strength helps people cope better with stress and suffering. A person who has inner peace, or who has a defined purpose or meaning of life, all in all, if they are ill, still they have a purpose and meaning of life. So they are going to cope up in a better way as compared to somebody who does not have a good spiritual health. Okay, so coping mechanism is also affected by spiritual dimension of health. Then we have vocational dimension of health. So vocational health refers to job satisfaction and work-life balance. Okay, so somebody who has a good work-life balance and somebody who is satisfied in his job, it's more, uh, you know, there are more chances that that person is going to be happy, healthy, and more peaceful in life. Okay, so also vocational, somebody who is vocationally healthy has a good source of income, has a good work-life balance, then the financial dimension of health is also managed, and that manages the mental dimension and also the social dimension of health. So that affects health very well, the vocational dimension. Okay, so the vocational dimension includes safe working environment, job satisfaction, balance between work and personal life. For example, a person who is unhappy with their job may experience stress, anxiety, even mental and physical illness. And in today's world, occupational stress is a major public health concern. So vocational dimension also becomes very important in such cases. Intellectual dimension of health. So, intellectual health refers to the ability to think logically, learn continuously, and apply knowledge effectively. So, it includes curiosity, critical thinking, creativity, evidence based decision making. For example, an intellectually healthy person questions myth and misinformation because they know the difference between myth and reality. Okay. So, such people keep learning new skills. They try to understand health information properly. So, in public health, intellectual health is essential for research, data interpretation, and policy making. So, somebody who is able to think critically and logically is very productive for the society as well. Okay, so intellectual dimension is also equally important. They have some other dimensions of health, like environmental dimension. It refers to clean air, safe water, proper sanitation, and pollution control. Poor environment leads to diseases like asthma, diarrhea, and infections. Then we have some other dimensions like financial dimension. So, what does financial dimension mean? It refers to financial security and ability to meet basic needs. Somebody who is able to afford his basic needs, he is able to afford his family needs. That's going to reduce his mental stress, all in all. So so financial dimension is equally important. Somebody who is not earning well, he's financially dependent on somebody else, then they might suffer from mental illness, all in all, and that mental illness is going to, you know uh, affect their health. Then emotional dimension. So in emotional dimension, when we talk about emotional health, it refers to understanding, expressing, and managing emotions effectively. Emotionally healthy people handle anger, sadness, and happiness in a balanced way. It's not like angry, they'll be very angry. And if they're happy, they are going to be very happy. So emotionally healthy person is able to handle anger, sadness, and happiness in a balanced way. It's not the extreme way around. Okay. Then we have interrelationship of dimensions. So all dimensions of health are interrelated. Why these are interrelated? As you saw that in each dimension, I gave you examples that were relating to one another. Okay, so interrelationship of dimensions is seen. Like one dimension might affect others because health is actually a uh, holistic thing. Okay, so holistic means it comprises of many parts. So these parts, you can say that health comprises of many dimensions. So if one dimension is affected, the other might also be affected. For example, I'll give you some example. So just imagine somebody losing his job. Somebody who is losing a job, his vocational health will be affected. This is going to affect his financial health, and that financial health affection is going to give him stress, and this mental stress is going to affect his physical health as well. Okay, so that is an example that is very relatable, and you can write how the dimensions of health are interrelated. Okay. Then we have some previous year questions. So these questions have been asked in these examinations that I had mentioned before, and you can just answer these and put the correct options in the comment if you want. And whoever gets all the questions right, I'll just pin their comment so that everybody can tally from that. And thank you for your attention. And to conclude, health, as we know, is multidimensional concept, and true health can be achieved only when all the dimensions are balanced. So, if you found this explanation helpful, please like, share, and subscribe to Public Health Insights for more easy and exam-oriented public health content. And if you are having any doubt, or if you want to ask anything, then you can reach out to me on LinkedIn, and I'll be happy to help. And in case of any uh, suggestion, please mention in the comments below. Thank you, and please like, share, and comment. Thank you.